How is miliary TB diagnosed with X-rays? Have you ever wondered how doctors diagnose miliary tuberculosis using X-rays? Miliary tuberculosis, often referred to as miliary TB, is a serious form of tuberculosis that spreads throughout the body. One of the key tools in diagnosing this condition is the chest X-ray. When doctors look at a chest X-ray for miliary TB, they are searching for a specific pattern. The most notable feature is the presence of numerous tiny nodules, each measuring about 1 to 2 millimeters in diameter. These nodules are spread evenly across both lungs, creating a pattern that resembles millet seeds, which is how the term miliary came about. This pattern is described as diffuse, bilateral, and reticulonodular, meaning the small spots are distributed uniformly and from a fine network across the lung areas. Chest X-rays are typically the first imaging test used when miliary TB is suspected. They can reveal thousands of these tiny spots, which are characteristic of the disease. However, it is important to note that in the early stages of miliary TB, these findings may not be obvious. A normal or nonspecific chest X-ray does not rule out the possibility of miliary TB. In such cases, doctors may turn to more sensitive imaging techniques, like high-resolution computed tomography scans, to identify smaller or less visible lesions and assess the extent of lung involvement more accurately. Besides chest X-rays and computed tomography scans, other imaging methods like ultrasound, magnetic resonance imaging, and positron emission tomography scans may also be used. These techniques help evaluate whether other organs are affected, since miliary TB can impact multiple areas of the body. While chest X-rays provide essential visual evidence, diagnosing miliary TB requires more than just imaging. Confirmation involves microbiological, molecular, or histopathological evidence of tuberculosis bacteria. This can be obtained from various samples, including blood, sputum, cerebrospinal fluid, or tissue biopsies. In some cases, a procedure called bronchoscopy with bronchoalveolar lavage may be performed to collect lung samples for testing. In summary, chest X-rays play a crucial role in diagnosing miliary TB by revealing a distinctive pattern of tiny nodules throughout the lungs. This imaging finding, along with clinical symptoms and laboratory confirmation, helps establish the diagnosis. Recognizing this pattern early on is vital for timely treatment of this serious form of tuberculosis. Always consult healthcare professionals for personalized medical advice and information.